All right, let's jump right into the big updates from the GOLD 2026 report. Over the next few minutes, we're going to walk through the most important shifts that are really going to change how you manage your patients with COPD. This is the sixth major revision of the GOLD strategy, and it's definitely not just a minor tweak here and there. It's bringing some pretty fundamental changes to how we think about COPD. So the big question for all of us is, what does this actually mean for our day-to-day work in the clinic?
Okay, first up, and this is a big one. It's a major shift in the whole philosophy of how we assess our patients. We're moving away from just a static snapshot and toward a much more dynamic way of looking at their condition. It all centers on a brand new concept. And that new concept is called disease activity. GOLD 2026 is really pushing us to manage patients toward this state of stability. Think of it like a dashboard for your patient's COPD. Are they having exacerbations? Are their symptoms getting worse on their CAT score? Is their FEV1 dropping faster than it should be? The whole goal is to get all of these things quieted down into a low activity state.
So here's where the rubber really meets the road. This new focus on disease activity translates into a very clear clinical action. The bar for escalating therapy is now much, much lower. A single moderate exacerbation, just one, is now a clear signal to stop, reevaluate, and probably step up their treatment. That's a huge change from the old way of waiting for a couple of events or a severe one. So if we're going to be more proactive, what does that actually mean for our treatment algorithms? Well, GOLD 2026 gives us some much-needed clarity, especially when it comes to starting therapy versus adjusting it. And this is a simple change, but it's so important. The guidelines now have two very distinct paths. There's one clear algorithm for initiating therapy for those patients who are treatment naive, and a totally separate one for follow-up in patients who are already on medication. The split really clears up a lot of the confusion we had before. Now this is a huge addition. For the very first time, GOLD is giving us formal guidance on biologic therapy and COPD. The key takeaway here is pretty straightforward. You should be thinking about this for your patients who keep exacerbating and have a blood eosinophil count of 300 or higher. The report even gets specific, detailing the evidence for agents like mepolizumab and dupilumab in this group. All right, let's talk about the structure of the report itself for a minute, because two of the most critical chapters got a complete teardown and rebuilt. This reflects a pretty major update in how we think about exacerbations and multimorbidity. First up, Chapter 4, the Exacerbations chapter, it's not just a refresh, it's a complete rewrite. We're talking updated definitions, new data on how to prevent them, and a more refined approach to managing them when they happen. This is a section you're absolutely going to want to review to make sure your approach is current. And it's the same story for Chapter 5 on multimorbidity. This chapter has been completely overhauled, and it's a huge shift from just, acknowledging that our patients have other problems. Now it gives us real actionable ways to screen for and manage things like cardiovascular disease, osteoporosis, and anxiety, which, let's be honest, are the norm for our patients. And this quote from the new chapter really hits the nail on the head. We have to treat the whole patient. It's a powerful reminder: heart disease, bone health, mental health. We need to be actively looking for these things and treating them according to their own guidelines, totally independent of the COPD treatment plan. Okay, shifting gears a bit, let's talk about the future. Because for the first time ever, GOLD has added a whole new chapter that's looking straight at the role of technology in our field. Yep, you heard that right. We're talking about a brand new chapter, Chapter 6, all about artificial intelligence and other emerging technologies. It's positioning these as some really powerful tools that are going to help us personalize COPD care down the line. And this isn't science fiction, right? The report lays out some really practical ways AI could start helping us in the clinic. I mean, imagine a system that can scan the EHR to flag polypharmacy, help you read a CT scan, or even predict a patient's prognosis. It's not just about being more efficient, it's about freeing us up to spend more time on what really matters, actually talking to our patients. So why all these big changes? Why now? Well, this number right here tells you everything you need to know. $24.35 trillion. That's the projected global direct cost of COPD by the year 2050. A number that big demands that we get more strategic right now. That's the trillion-dollar question, literally. How do we start to bend that curve? Well, the changes in GOLD 2026 aren't just academic.
They represent a really clear evidence-based strategy to improve our patients' outcomes, and by doing that, start to tackle this massive global health problem. All right, we've covered a lot of ground. So let's boil this all down. What are the absolute must-know, practice-changing takeaways you need to walk away with?
Here's your checklist. Number 1, start thinking in terms of disease activity. 2, lower your threshold, escalate treatment after just one moderate exacerbation. 3, use the 2 separate algorithms for initial and follow-up care. 4, go read those completely revised chapters on exacerbations and multimorbidity. 5, start screening for patients who might be candidates for biologics. And finally, number 6, just keep an eye on how AI is going to start playing a bigger role in our field.
So, at the end of the day, these updates are a pretty big deal. They give us clearer, more proactive strategies to help our patients. And I think the final question the report really leaves us with is a personal one for all of us. How are we going to adapt our own practices to be ready for what's coming?